question we get asked a lot is, how easy is it going to be for me to implement the skills and the techniques that I pick up on the PG cert or the PG diploma into my clinical practice. Don't forget that the whole aim of the PG cert and the PG diploma is really to give you skills that you can implement into your clinical practice. This isn't a theoretical course. It is a combination of theory, but very much everything has a practical emphasis. So for things like surgical crown lengthening, we'll be doing surgical crown lengthening exercises. You'll be doing tooth preparation exercises. You'll be doing practical occlusion exercises like Facebook records and mounting models. For composites, etc., you'll be handling all the particular matrices and doing the procedures. So what we aim to do with all the courses is that, yes, you have those skills to take straight into your clinical practice. Now that will benefit your patients, and financially that should benefit you as well. Also, don't forget the fundamental things, the perio, the diagnosis, the risk-based planning, all of that will improve your patient care, and you should be able to implement that straight into your clinical practice. Let's be honest, we have an NHS system and a private system. Any course like the course I offer is really more geared up for you to undertake private dentistry. So there is still a lot of the course that you can implement with NHS dentistry, but it is particularly applicable for those of you who want to be moving more into private dentistry or undertake more private dentistry. So there's always going to be elements of the course that within the NHS you're going to struggle to fully implement those, but all the fundamentals apply to NHS or private dentistry because, there is at the end of the day just good dentistry. So I hope that helps with that question.